Hello and welcome to the fireside chat on making healthcare accessible to all. I am Kalpana Singhal, Editor-in-Chief Health Technology, a community under CXO TV and Techplus Media. After the COVID-led unprecedented crisis, the Indian healthcare industry is undergoing a major transformation. The COVID pandemic has brought the inadequacies and pitfalls of India's healthcare system to the light. At the same time, the pandemic has also opened up the way for digital intervention in the healthcare systems, which are supposed to alter the healthcare landscape in 2022. Meanwhile, the government is also increasing public health spending to 2.5% of the country's GDP by 2025. Besides, the government is also taking initiatives to make healthcare more affordable and accessible. We have a very eminent guest to take us through the achievements and ground realities in healthcare and government steps as she leads digital health initiatives from the front. Please welcome Nambiar, Chairperson, Digital Health India Association and CEO for Dalmia Healthcare. She has contributed more than 40 years to healthcare.
Thank you so much and good day to everyone.
So government is pushing to make healthcare more affordable with initiatives like Ayushman Bharat, coupled with its focus on overall health and wellness. So with these initiatives from the government, do you see the Indian healthcare system getting more cost-effective, equitable, and shifting away from sick care to prevention and early intervention?
Yes, Kalpana. I think such an intervention was long overdue from the side of the government. And one of the good things that happened is this entire, catalyzing of the digital health mission and the initiatives that have bankrolled quite fast, I should say. Although the Ayushman Bharat scheme at the moment is limited to the people below the poverty line, where the government is supporting them, and mostly in the government hospitals, with very few private hospitals being part of it, I see this initiative leading to a much larger scheme of things, where eventually perhaps we can see in our country, something like a social security system where every individual can get covered by such an insurance scheme. Because, today we are all so insecure about falling ill in our old age, and we are saving and doing all kinds of, private insurances just because we are scared of falling ill. But I think that just like how it happens in the more developed countries and in Europe and all that, I think that is where the government will take this mission to. It's too early at the moment to say that, but I think that's the direction where we can hope to go if everything goes well. And yes, in terms of accessibility also, the major initiatives in telemedicine, you see how much the government has done, and a lot of private companies have come forward, and there's so much happening. That accessibility is also improved now. Quite a lot, I should say. And just like what I said, too early to say anything, but a step in the right direction, definitely.
Yeah, absolutely. So a prevention model is ideally suited to address chronic conditions that take decades to develop and then manifest as a life-threatening and ultimately fatal exacerbations. So what are the steps you see from the Indian healthcare players to progress towards a disease prevention model? And what is the level of progress you observe in India?
So the entire concept of, wellness was only limited to parts. Like we had all these preventive health checkups done in the private hospitals, but you also had a lot of, I don't know how well you're aware of these indigenous systems of medicine in Ayurveda and all that, a lot of focus on wellness. And if you know the people, I'm from Kerala, so I know how almost 90% of the Malayalis will go for these Ayurvedic things for wellness, not so much for illness, okay, as a preventive health thing, to remain well, to take care of the health. So all this has definitely now come to the fore because COVID has made us realize that what we used to do earlier, we used to work in silos. Nobody was cooperating with each other. Hospitals wanted to have their own little success story in a little bubble of their own. It was more focused on acute care, that also tertiary care. not so much on primary care, and certainly not much on wellness. One thing that has happened with COVID is that we've realized that that model had a lot of mistakes. So the model has to change. There has to be more effort on primary healthcare and on wellness, because that's the only way you can prevent the tragedies that you see in acute care, in tertiary care, and reduce the cost of care, because wellness costs much less. Tertiary event costs so much more. And with the focus on wellness and primary care, you can expect much better healthcare for the individuals. So reducing cost and much better human capital, both can be achieved by this. So I definitely see that happening. And also for the non-communicable diseases, with the advent of digital health, you find telemedicine being used for follow-ups. See, one of the major determinants of remaining well with non-communicable diseases and remaining well as in preventing a catastrophic illness is a carefully crafted follow-up plan and the maintenance treatment. For this, a lot of people get fed up of coming every 3 months or every 6 months to a town to see their specialist. Now they don't have to. With telemedicine, they can follow up from wherever they are. You can travel freely. So you are connected with your doctor, but you do not have to really travel for all this care. So that also is a major factor that will, help us move towards this wellness focus.
Yeah.
Yeah.
So you think, as you rightly said, the hospitals also, need to think apart from earlier the way they were thinking about their own success stories. So that has already been started. And what about rural India? Like when it comes to telemedicine and the other healthcare facilities, you think the things are going fine in the tier 3 and 4?
I would say yes. Yeah, I would say yes. You have to look at how cell phones have become so easily, so penetrated today, the mobile telecommunications in the rural India. Everybody has a smartphone. The penetration of this mobile technology to rural India is the biggest factor that has made telemedicine reach the last mile. You can today connect with every single person in India, even in the remotest corner, because whether you have a road to go there or not, it is immaterial, but you definitely have a cell phone there. And that has lent itself to an easy access through telemedicine. So the question of, the inaccessibility of care, like earlier, we always said that what are the problems with healthcare in India? One was access. The other thing was equity and quality, right? And of course, the affordability. So access has become now a question of the past. I think almost everyone can reach through telemedicine. Now, telemedicine, we have to understand that, today we think telemedicine is just a teleconsultation. It's just a consultation between a doctor and a patient. Telemedicine itself is evolving. Now, today you have teleophthalmology, telepathology, teleradiology, tele-ICU, all of this. And even if there is a small nursing home where there is a very sick patient in the remote corner of the country, they can be accessed through a tele-ICU application from a tier 1 town, and you can give an acute care advice. So telemedicine is not just for chronic care. People must understand, it's not just for follow-up, it's not just for chronic care. It will also be used increasingly to make acute care affordable to the remotest of locations. So yes, that's the direction in which we are moving. It might take a little time, but the advances in telecommunications technology are so huge, and the number of people who are now working for digital health and making it successful, and the guidelines from the government to actually make the digital health mission a success story, it's all working together and, telescoping this change in such a manner that, I'm sure if we are discussing it 3 to 5 years down the line, we will be in a different healthcare scenario in India. Surely. Lots would have changed.
Yeah. So as a layman, as you pointed out that, okay, people are a bit confused between teleconsultation and telemedicine. So as per our understanding, teleconsultation is something which these days is happening through WhatsApp. Even doctors in India during the pandemic, everyone was giving consultation. They were sending the prescriptions through WhatsApp, and patients were sending their pictures, images. They were sharing their images through WhatsApp. And but what about of late we can see that, okay, the how they were actually monetizing it, because there is no proper channel. A patient has to first do a Paytm or some Google Pay or something, and then after seeing that, they expect a call from the assistant, and then fix up the time with the doctor. So during the COVID period, all this started, it took off. So what do you think, like, how this can be streamlined, that what should be a way, to actually make it easier, that instead of making the payments through Paytms, and then waiting for a call for the appointment, and then you can just speak with him. So how it can be streamlined, how and
So,
when
yeah.
exactly we are expecting, the things to be more organized?
So, as you rightly said, there is a lot of chaos in the system at the moment. But you expect that in a crisis. See, COVID was crisis, unexpected, nobody was prepared. And in this chaos, a lot of these solutions were created because you have to handle an emergency which you have never seen before in your life, and you just want to get over with it, isn't it? So all this has happened in a chaotic environment, and it is true of every chaotic situation. Multiple people with multiple ideas will come with multiple solutions. Not all will sustain. Okay. The other thing is that the regulations. See, when you put guidelines, it's different. But when you put a regulation and you make an act, you are restrictive. Now, if you make a restrictive environment when you are handling a crisis, you might actually do more harm than good. So, what was the idea? Let everything happen. Let anyone who thinks that something is helping, let it help. So, if it's a WhatsApp call, let it be done. At least somebody is benefiting. That's why it's being done. But over a period of time, things will get filtered down. You will have more concern about, data security, data privacy, confidentiality of patient, confidentiality of the doctor, confidentiality of your electronic medical record. Now, all those things will come in. Now, it will not come overnight, because a lot of hard work has to go into thinking as to what is the right way to do it. See, it's very easy to say, oh, patient confidentiality. But patient confidentiality, when you look at how an American thinks of it and how an Indian thinks of it, is very different.
Yeah.
See, when you, in our families, when somebody falls ill, the whole family, the whole neighborhood, everybody knows what's wrong with us. And we happily discuss it, right? That's our context. That's our cultural feature, right? Whereas, and even when you see how telemedicine applications work in rural India, not everybody has a phone and not everybody knows how to communicate their problem with the doctor. So there will be a kiosk. Somebody will set up something in their house, a practitioner or somebody who can guide, a retired nurse or an RMP. And the villagers go to his house and they will be describing their illness to the doctor, which for many people, the RMP will be translating. And there'll be at least 20 people waiting in the queue listening to all this conversation. That is the reality of India. Now, you have to make your data privacy laws and in this context.
Yeah.
So for
a very fair point.
Yeah. For an IT executive or a CEO, data privacy means that, my right hand should not know what my left hand is doing. And where you have, but the majority of India in rural context, it behaves like what I just told you. You go to a government medical college, go to the outpatients department. There is a different system. I mean, it's like, a lot of people hear what you're saying. I'm not saying that is correct, okay? But you cannot overnight clamp it and say data privacy. then you will be harming all those people who are taking this telemedicine support to at least access care. So you have to see how to prioritize. Access is more important than privacy in that context, isn't it? So we need to have our systems worked out in a manner where over a period of time, we might, reach where, every single person understands the concept of data privacy and all that. But until then, no. So going along the path of making, everybody data literate, everybody conscious of what your private healthcare information has to be private and how it has to be done, it has a social context. It has a cultural context. And India has too many socio-cultural paradigms which you need to cross before you will, do a homogeneous data privacy law. So yes, all those will happen slowly, but we need to prioritize. And that's why I said, you cannot do anything overnight. You have to do it over a period of time, think it through, make sure that every step that you take forward, it's not resulted in 2 steps back with the progress that you are trying to achieve or what you have achieved now. I mean, COVID has, helped us achieve a lot of progress in permeation of digital technology in healthcare. So each step that we take now, each regulation we make, each guideline that we create has to help this movement to go forward rather than go back. Because each step back is going to be very difficult to then push forward. So the momentum that we have gained has to be continued to move forward. And in that, if we have to, blindly, close our eyes to a few things, it's fine. As long as it is not harming the patient care, as long as the patient remains safe. I think that's important.
Yeah, absolutely. The patient data is critical, but of course, the access is the first thing we have to make sure.
Right.
Definitely, it's a fair point. And hats off to the doctors, even though it was through WhatsApp, but I can see, we have seen, all of us have seen that how busy they were. They have done a tremendous job during the COVID.
Absolutely.
I think they were talking to it not less than 50, 60 patients in a day, though it was through
maybe
WhatsApp.
Far more.
Maybe it's far more. Yeah. All right.
Doctors by nature, they will do anything to reach their patient, even if it involves adopting something which they have no idea about before. That's something which is very characteristic of the community of doctors, because that's how you're trained.
Yeah, that's what has made them so honorable.
Yeah.
Yeah. Okay, so tell us something about your digital health initiatives and steps to make healthcare accessible to all.
Yeah, so when we started out, just as COVID outbreak happened, and we realized, and as we are discussing, this whole mushrooming of telemedicine solutions, and every person who had some idea of technology was trying to create a telemedicine solution, and every doctor was being bombarded by many technologies saying, I've got this solution which is the best for you. And as we said, that doctors didn't know anything about this technology. A lot of us did not know how it is to be used, and especially this whole concept of data privacy, data security. How do you identify? How do you ensure that this is not a crank call? Because we all get a lot of fake calls as well. So like that, so we were asked by some of the users to see whether we can find out how to tell which is a right solution for them. So we started with an initiative to create a registry of telemedicine solutions, which we have done. And we are progressively evaluating more and more telemedicine solutions. And for that, when we searched the literature, we found there is nothing that actually can evaluate a telemedicine solution from the side of the user. Like, I'm a doctor, I'm a user. I run hospitals, so I'm a user. And for that point, as to which is the best for the user, there was nothing, no grid really, no tool. So we, have a lot of members who contributed to creating this tool to create a registry. And when we were doing that, we also found a lot of people who do telemedicine solutions. I was telling you that, there'll be telepathology and teleophthalmology and all of that. And there are also a lot of digital devices, like you have a digital steth, which can give you better heart sounds than, the stethoscope that we routinely use. And it can also give you better interpretation of heart sounds and things like that. So a lot of telemedicine solution companies wanted to have these devices incorporated into their solutions to make it better. And they didn't know where to get it from. So because they started asking us, Ki hame batao, do you know where to get it from? So then we started a search for looking for those devices that can be, applied into telemedicine solutions. And then we had to create an evaluation model for them so that the telemedicine solution companies can. So this is, an ongoing work which we are doing, and we've created a registry for both. And I'm sure as we go forward, we'll find that continuously people will improve. And one of the things that I found was that clearly what is lacking is that the technology developers and the domain experts, like the medical doctors or the nurses, that communication platform is also very limited. So our effort is to see that we can do some capacity building, train these people. We are also now getting engaged with some of the companies that want to do capacity building and, really teach the doctors and the nurses and the healthcare workers about the importance of their participation in digital health mission and what is the role that they play and how it is important for them to be data literate. Because you see, when we all have studied our medicine in schools and colleges, we have no concept of data literacy. So that's not yet become mainstream in the curriculum. So we have to teach everyone outside. So that's another initiative that we are now undertaking. So yes, that's our main focus now, to help people train.
Yeah, that's wonderful. Yeah. Also, what we over the period we have realized that there is a shortage of pyramids as well when we talk about telemedicine. So
yes,
apart from the technology, from the user perspective, even the equipments from the other side, in the hospitals where the pyramids are there and people, especially in the rural India, they are walking down to the hospitals which are quite on distance, and then the experience they are having, the equipments are not that good,
right,
and even there is a shortage of pyramids.
Yes,
I think even the doctors, who are supposed to be available there for telemedicine, they are also, too busy when it comes to government hospitals. So, that was the scenario earlier. So, what is the latest now? How we are dealing with this kind of a problem in tier 3 and 4? If you can throw some light.
See, manpower, yeah. So shortage of trained manpower is a global problem. Okay. And in healthcare, it's a huge issue. Less number of people are getting into these fields also. That's another issue. What will happen is when we use technology, what we have to do is we should not be copying what is the current system and making it digital. That's not the aim. We should use the digital technology to make the existing system more efficient and to see, can you reduce the workload on the existing people so that you can free them off to do what they're actually supposed to do? And are there some of those jobs for which we don't get adequate manpower today? Can we replace them with technology? So can I use a chatbot for a lot of my telephone calls rather than using a telephone operator as a... So if my first line 100 calls, if I have a chatbot that answers and only 10 of them need an interpreter and an operator, I'm reducing that work load. Okay, so I'm reducing that manpower, which otherwise is anyway difficult to get. Similarly, in technology, a lot of the work that right now some of the doctors are doing or the technicians are doing can actually be used by use of digital technology, by either using machine learning or through various AI algorithms. And if that can be incorporated, what you get is not only um, handling the manpower shortage issue, but the existing manpower, that is, although less in number, they will work more efficiently. You are increasing their efficiency. So that's what we have to look at. That's how we need to really use technology. It's not like I used to write like this on paper, so I used to write like this on computer. No, not at all. Sometimes I wrote like this on paper. I don't have to write it at all. I don't need that document, right? Because it is getting auto picked from your Aadhaar card and here and there everywhere.
Yeah.
That's how you need to not replicate everything and duplicate the mundane work that we were doing. Reduce. The nurse writes it on a nursing record, then somebody who's giving it writes again in the record and saying, I have administered it. No, write it once. And then everybody who has to see it, whether it's a pharmacist, whether it's a nurse, everybody can see it. Nobody needs to, write it again. Use a barcode and, to indicate the administration. No need to write that I have given it and tick and forget to tick and all that stuff. So what have you done? You've reduced the workload and you've freed up all these people in their time. So you can free up a lot of time with this. And therefore you're not saying, okay, in my paper 4 people went and wrote and ticked against it. You don't need to do it. So that's what we have to do. That's how digital has to work.
Yeah, definitely. With the digital technologies, a lot can be done. Right. So the ongoing pandemic has highlighted the importance of robust healthcare as well as technology infrastructure to support the accessibility and effectivity.
It's like in all the sectors.
Yeah. So how do you think technology will improve well-being in healthcare?
So as I said right now, see, one of the things, so a few things are going to happen. Let's put it this way. One is that a whole lot of us are going to be individually involved in our healthcare much more. Okay, so if I have a digitized health record, which is my personal health record, and I have, a single longitudinal electronic record of every citizen right from birth, I wouldn't even call it a patient's record because not all of us are patients. So we'll have our records of our vaccinations, our spa visit, and our gym visit, and our, nutrition and everything. So you are already in control of all the data, which is pertinent to your health.
Yeah.
That will drive a new kind of demand. And that demand is that of remaining well. See, all of us, we go to the hospital when we fall ill because we do not clearly understand the concept that we should focus on remaining well. So this whole focus on remaining well will improve, through use of this technology, because your data is in your hand. And that can only happen. It'll come on your phone only because of use of digital technology, isn't it? Right now, you don't have it. You don't have access. It's lying in some hospital somewhere, or, lying in some record somewhere. You have some scanned reports and that's about it. So that is one. So the whole focus will be demand. I mean, it'll be because the individuals themselves realize, and this eventually will progress to personalization of treatment. And personalization is it not just, your genome sequencing and saying that, okay, you are prone to this disease. Yes, that's a major part, but it'll also get personalized logistically. As in, I'm traveling, I'm at the airport, I'm somewhere else. I will have access to my doctor and my records and my care even at that point. So personalization beyond just getting my genomic sequencing right and saying what disease I'm prone to and trying to do my genetic modeling and modification. So it will be an all-encompassing personalization, which will also take into account what kind of food you like to eat, and you can eat that, and what compensations you can do, so that if you're prone to a certain disease, what are the compensatory mechanisms you can induce in your lifestyle making sure that you don't have to give up what you like. So if you like a glass of wine, you should be able to do it, compensate by doing something else, which will, reduce that harmful effect that you have, or, things like that. I mean, your lifestyle changes do not have to be restrictive. They can be facilitative. The knowledge can actually improve your lifestyle by, right now we say, okay, remove, don't eat sugars, don't eat carbs, don't eat this, don't eat that. Instead of that, it can be personalized in a facilitative manner, not in a restrictive manner. And so as a result of which you're more happy, isn't it?
Yeah.
It'll actually create more happy people, I think.
Yeah, I completely agree with you. So
Yeah.
we can
And
have more of
okay, like, you're a diabetic and you can still, this is how you can sweeten your food, or this is how you compensate and have a glass of wine. Well, people will be happier.
Yeah. And in terms of technology, the variables can actually help you in the well-being, just assessing the symptoms. And
yes.
Yeah.
Yes. I mean, nowadays, wearables, we are going into a era where we are going to be wearing so many sensors. Forget wearing, your room will have everything. You'll have smart homes. You'll be living, your car will be a smart car. Your office will be a smart office. You don't have to worry. I mean, I could be sitting here in my room. The sensors around my office, and my office will tell my doctor, and it will be, record the data on my electronic health record. And if there is something worrisome, my doctor will get alerted before I even know something is wrong. Isn't it? If my blood pressure is shooting up, or if my sugar is high and there's a sensor I'm wearing, it will alert my doctor, and my doctor will, perhaps call me, or, tell me what is to be done. So, we are moving into that era, and we are moving into that era quite fast. I mean, yeah, this is something which is happening, which of course I expect to see in my lifetime, all this happening. So surely we are moved, and it's not sci-fi, it's all happening. So yeah, it'll become really,
so maybe before 2047 or by 2047.
much before
Yeah.
far before. In the next 5 to 10 years, we are going to be living in homes like that. Already there are people who are doing it. So it's just that it is very expensive now, and it's not available to everyone, but it will become common. As you have more apps coming in, you have cheaper sensor technologies coming in. I mean, you will be walking with a, chip under your skin, or chip on your t-shirt or something like that.
Yeah. So what are your suggestions or best practices to make healthcare accessible and affordable to all? And how do you see personalized home care to support these initiatives?
So personalized home care, as I mentioned to you, it's an outcome of all these developments that are going to happen. Now, how is it that we have to expect that it'll get promoted faster? This is where one level is our capacity building for every individual. All this has to become part of our teaching, even at a school level. Okay. The other thing that we have to do, and I think as a country, we need to, and we've seen a lot of innovation happen in the last 2 years. It's not that these people were not there 2 years ago. The chaos in the country demanded that innovation to happen, especially in the digital tech space. We have to encourage more innovation. We have to bring in a culture of innovation. We need to make sure that we don't put regulations which make it difficult for the innovators, very smart innovators with bright ideas, कि funding नहीं है, mentor नहीं है, domain knowledge deficiency. We have to create a culture which is more of innovation rather than a copy paste of technology or re-engineering of technology that happens somewhere else. So we need to change the way we think. We need to encourage people to ask questions. We need to encourage people to innovate. And this is where I feel government has done some work, but I think far more needs to be done. We hardly spend any amount on healthcare, but we spend far too little on research. We spend far too little on funding innovation. And I think that culture must happen, because then only technology will develop. Unless it is innovative and developed in your country, it will not develop. It will not progress further. So this has to be. And all along, I mean, for years, we've thought, what is it that will be that one thing that will disrupt the healthcare space to make it more affordable and accessible? We also knew it will be digital technology, but nobody used it, right? The last 20 years, we've been using it in bits and pieces. But COVID happened, and lo and behold, fortunately, that whole disruption, we can say that COVID was a disruptor, but the actual disruption is the use of digital technology. Let's not forget that. And the change that is going to be brought about is by rightful use of technology. And as we already discussed, that if we have to not lose this momentum, we must make sure that whatever gains we have made in the last 2 years, we can consolidate them and create the right environment to see that we don't lose what we have gained. Because it's very easy to slip back into where we were. So we need to make sure that we don't slip back. And personalization of medicine is going to come as an outcome of culmination of all these various things that are happening. It's about the digital health mission being successfully adopted in the whole country, every citizen having control to their own data, knowing how to give access of their data to the doctor or the technician, and working together to make sure that primary care remains a focus area, primary care and wellness. And all that has to come together, and has to come together quite rapidly. I mean, we can't afford to spend 50 years to try and get there. We have to do it in the next 5 years. We have to do it in, we need to put the building blocks. And like it or not, digital is the basic infrastructure now. When we make a hospital, when you make a healthcare system, you create a brick and mortar structure. Your digital structure, the infrastructure, has to be parallel. You cannot ignore the digital aspect of the infrastructure. It is the most important infrastructure now, which is going to be for any healthcare provider.
Yeah, absolutely. So over these years,
ignore that.
Yeah. We have been talking about interoperability a lot, but still, I think not much has been achieved when it comes to interoperability. Though we have been talking about digital technologies. At the same time, if we see other sectors like BFSI and other, so if they can do, then what is the reason?
Healthcare is also doing, and I'm not saying that. See, what has happened, I mean, where you find that interoperability is an issue is wherever we are dealing with some legacy systems, and it is difficult to integrate because of the older technologies that they were adopting. But now you'll find that more and more, see, the technology providers also have to understand that no longer I can sit in silos. I mentioned to you in this beginning that hospitals were working in silos. They didn't want somebody else's report to be integrated into theirs, or anyone else to know what was written in the medical records of the patient, which they are right. They didn't want to share it with anybody else. Labs were working by themselves. Ki hamare lab ki report, it's only in my lab and not in another lab. Now that space is, open. And as I said, when the patient demands, if supposing I have my health record with me, or you have your health record with you, you want all your health providers to put the record in your hand, and it is for you to share it with everybody else. So now if you want to be in the race, you better have interoperable systems. So people have realized that but one of the things I must say that in the healthcare system, although people have realized it, but the know-how of how it is to be done, the senior doctors and the people who manage hospitals or the people who own hospitals, this knowledge is not entirely there. And that's where this whole capacity building has to happen, is that they must understand that interoperability means this. See, you and I know what interoperability means. But you ask a senior consultant who's, let's say a cardiologist or an orthopedic surgeon, and you ask him that, okay, are you using the IT systems which are interoperable? I mean, half of them will say, what are you talking? Right? You go to a CEO and say, okay, I'm going to sell you this software and, it guarantees interoperability with any other software that you buy. And he'll say, okay, how much does it cost? If it costs extra, then I don't want to buy it because I don't know what the function is, right? So we need to educate people. But more and more people who are developing technology, more and more people who are developing equipments and devices, they understand this and they're adding that as a feature now. It's like a mandatory thing. If you don't have this feature available in the ventilator that you sell or the pathology equipment that you sell or the EMRs that you have, the chances are that you will get replaced and you'll not be bought. You don't have much longer, as a lifespan. So that's happening, and the government itself is, making sure that there are initiatives taken. So I feel that it's a question of, the learning. So learning curve now is shortened for people in terms of digital technology. The last 2 years have, made everybody realize that they need to know more. And all of us will have a much shorter learning curve in future. I mean, what has taken me 20 years to learn, today people can spend that, 2 months and learn the whole thing. That much is available for you to learn.
Yeah. So private sector, I can understand, but you think interoperability is not a problem yet in the government sector, the government hospitals?
So government hospitals, the government, I would say the health as well as the IT ministry, the way they are focused on changing the scenario. See, they are taking a step at a time. It might appear like a very small thing, like in Ayushman Bharat, when they ask you for records, they ask you for some basic minimum set of data. Once you get that basic minimum set of data, it is from the labs, it is from your medical records, it is your diagnosis. They're not asking you too much. And then there'll be some data from the Aadhaar card. The next step will be getting more data in. Now, how do you automate more data in? By ensuring that from whichever be the source of the data is interoperable to the existing system of data that you're providing. So even in the public health, see, public health, the beauty is that it is run by the government. So the government initiative and push for the digital health mission is going to see it through. Because if you see, the present government is hell bent on making the digital health mission a success. That drive is what is going to push the government. Yes, it's a state subject. When one state does it better than the others, there's a competition between the states.
Yeah.
And all of us, we move states, we move, within the country hell of a lot. So there will be a demand from the population also. So it's going to happen. So for me, I feel that the public health is better positioned today because of the government's single-minded determination and focus on this. Private hospitals, some of them might say it is expensive and I can't do it right now. Smaller nursing homes might not understand the full implication for some more time. But public health would probably have it easier because of the government support. Because funding will also come from the government. See, all these things are expensive. All of these are very expensive initiatives. So it's a huge expense for the government. Not easy.
Yeah, absolutely. So last but not the least, what is your vision for healthcare in India over the next few years?
So, we have discussed quite a lot right now. And so I would tell you one thing, that I'm very optimistic about the way healthcare is moving in India. One is the focus on improving public health, the focus on, accessing, giving access of care to the person, reaching the last mile. That's a job which, we expect the government to do, and the government is doing it. See, otherwise, we'd always say government is not doing, but this the government is doing. getting the right collaborations, the various ministries that have to work together. They are working together, the IT and the health ministry. The realization that COVID actually literally bombed us because our primary healthcare services were not good. That has happened, and there is a focus on improving on primary healthcare. Government is focusing on wellness centers. Now, when wellness centers get focused, insurance companies will start paying for wellness, not just for illness. Today, you see, insurance company will only pay you for when you get hospitalized for any treatment. They don't pay you your gym membership or your exercise routine or your nutritional plans that you might do to remain well. But that will also happen. See, once that change happens, there is a focus on a better human capital. I also feel that in India we have a vast knowledge in indigenous systems, in the Ayush systems of medicine, which we have, ignored for large part of, at least the modern day. There needs to be some kind of integration of various systems of medicine to see how is it that the Indian healthcare system does not just, we are not just copying what somebody else is doing. And that's what I always feel, that what we can develop on our own, what is the capability that we have on our own, will come to the forefront. If somebody, right now the situation, if someone in the West has to say yoga is good, then we start doing yoga. Okay, so I think, a combination of all this, a combination of the focus by the government to, increase I would say, the social security system of the population by promoting Ayushman Bharat and taking it to a level where all the people in the country are covered, which will happen. And better cooperation between public and private healthcare system, better cooperation between multiple healthcare providers. These are all things which we have ignored before. But I think the collaborative culture, the culture of innovation, this is what I see. We are already seeing that happening. And I think if this will continue, it's a huge future for the country. And I think government should also, not only the government, I think all the private players as well, the industrialists, the big business houses, must focus on investment in innovation, which has been taking a back seat. But I think funding for innovation, funding for research, this is happening in a very little way right now. But I think that is what I see. So I remain optimistic about the healthcare in the country. I do expect technology to literally help us go to the next orbit in healthcare in India. Surely, yes. And I also expect the Indian healthcare system, especially the digitized model, to sort of be something that the rest of the world will try to learn from. Because our technology entrepreneurs, our healthcare system, they are independently, they are recognized as the best in the world. And I think if these two together, they can work wonders. And we probably will be the digital health model for the world. That's my view. Okay, I've enough reasons, I think, to believe that I will see that happen.
Yeah, certainly. So thanks a lot, Uma, for this insightful session. And you have very rightly mentioned that health is likely to revolve around sustaining well-being rather than responding to illness. And while disease will never be completely eliminated, but through science, data, and technology, we will be able to identify it earlier and intervene proactively and understand its progression to help consumers effectively. And
either identify it early enough, or delay it so much through your wellness initiatives that you can live long enough without falling ill. Both we should be aiming at.
Actively sustaining the well-being, basically.
Yes.
So thanks again for taking out time and addressing few of the topics that are close to our audience interest.
Thank you so much, Kalpana. Thank you very much.
For more updates from CXO TV, please like and subscribe to our channel.